Welcome to Ajat Bioacademy. Today I will talk about beta blockers. Before going to the details, I will give you some interesting background of adrenergic systems, and that will be very helpful for your easy understanding. Okay, so our today's topic is beta blockers. Beta blockers. The interesting backgrounds. That is, the beta blockers comes from the beta adrenergic receptor blockers. So adrenergic, that term may come your mind. That is adrenergic. Okay. So adrenergic, it comes from adrenaline, noradrenaline. That is the master molecule behind the adrenergic receptors. Okay, so beta adrenergic receptors. That is adrenergic receptor. That is the concern terminology. So how does it mean adrenergic? So adrenaline, from that adrenaline comes from the adrenergic. So that is the adrenaline and noradrenaline. Okay, the master molecule behind the adrenergic nervous system, you can say adrenergic receptors activity. Okay, so this neurotransmitter, neurohormones are connected with your sympathetic nervous system. That means when you are in a fight flight mode, or running, or just doing excessive physical activities, then your one type of nervous system that will help you to do such type of activities, to show such type of activities. Okay, so that is the sympathetic nervous system, and the master molecule behind the sympathetic nervous system is adrenaline and noradrenaline. And these neurotransmitter will work on a particular receptor, and the receptor name is adrenergic receptor. And that adrenergic receptors are basically two types. One is alpha adrenergic receptors, another one is beta adrenergic receptors. Okay, so I will go for the types of receptors and their location and basic function very briefly. But before going that, suppose a dog is running after you and you are afraid and you are just try to go away, run away. So you must perform the more physical activities at that time. That means you have to run more and more. So your skeletal muscle functions would be increased, your oxygen supply, your nutrient supply to the muscle should be increased. So who will help you to do so? Your heart will help you, because your heart rate will increase at that time. Your lung function will increase. That means your lung will try to just supply the oxygen more. Your liver will help you to maintain more sugar level. So that means your skeletal muscle function should be increased at that time, because you must produce excessive energy. So energy source is nutrient and oxygen for your respiration. So both supplies will be increased in that particular area. And who will support you? Already I said your lungs, your heart will actively help you to supply more blood to that particular area. That means your skeletal muscle, that means your lungs. So how? Of course, the another part of your body, the blood flow should be restricted, and in that area, blood flow should be more. That will carry oxygen more. That will carry your nutrient to produce more energy. Your blood flow to be more to liver, and that will support you to glycogenolysis, or you can say gluconeogenesis, to produce more sugar, and that will support you to do more physical activity. So your heart will help you. So your heart functions would be high. Your lung functions would be more. Your blood flow to the lungs would be high. Blood flow to the skeletal muscles would be high. Blood flow to the liver must be more than normal. So in the particular area, particular organs, the blood supply must be more than normal. Okay, so of course, when you will supply more blood to a particular those areas, so of course you have to restrict the blood flow to other areas. So who will manage it? That system will be managed by your sympathetic nervous system. That means your adrenergic pathway. That means your adrenaline noradrenaline will help you to just restrict the blood flow to some extent in a particular area, and it will increase the blood flow in particular areas. Okay, so how? Through the activation of adrenergic receptors, and that receptor is alpha and beta. So alpha 1 is another, you can say alpha 1 and alpha 2, and beta basically three types: beta 1, beta 2, and beta 3. Okay, so just I'm talking about fight flight mode. So now your adrenaline or adrenaline will bind to the receptor in particular areas. So it will bind with the alpha 1 receptor, which is mostly present in your blood vessel. In which area of the blood vessel? Those areas blood flow is less important at the emergency situation. In your emergency situation, blood flow is less important in the particular areas. So in that area, your blood vessel should be constricted. Okay, vasoconstriction is important to restrict the blood flow in that area, to decrease the blood flow that area. Okay, so alpha 1 is basically responsible for the vasoconstriction because it is present in the blood vessel, where you can think about your kidney, you can think about your GI tract, you can think about your skin, okay, and any other less important area in the emergency situation in your different type of smooth muscles. So in that area, your blood flow should be restricted. And who will help you? Alpha 1. Okay, so adrenaline or noradrenaline will bind to the alpha 1 and it will make the constriction of the blood vessel, and that will restrict the blood flow to the less important area during the emergency situation. And that excess blood will go to the particular area where it is very much important. Okay, and this alpha 2 is basically the just showing the negative feedback inhibition matter. When it will the sympathetic mode will be excess, then it will make balance by negative feedback inhibition. So I will not focus on it. Now come to the another area. That means already I said, you know, your central blood supply organ is your heart. So heart function must be more because you are doing exercise or your fight flight mode. So your heart function must be more than normal. Okay, because when heart function will increase, heart rate will increase, cardiac output will increase, your blood flow to the basically arteries and then so on will increase. So adrenaline or adrenaline will bind with the beta 1 receptors on the heart. Okay, heart, and it will increase the heart rate. Okay, and that is the beta 1. Increase the heart rate, because it is very important. Okay, now come to the another one, that is beta 2. So already I said, in your lungs, blood flow should be more. In your skeletal muscle, must be blood flow more than normal. In your liver is a glucostatic organ, and that will maintain excess sugar, the blood. So of course, their blood flow to be more than normal in emergency situation. So in those areas, the blood vessels or the smooth muscle carry more beta 2 receptor, and when the adrenaline or noradrenaline bind with the beta 2 receptor, it will causes vasodilation or the smooth muscle dilation. Okay, so vasodilation. So this is causes already said this causes vasoconstriction. Okay, you will indicate the negative way, and it will cause the vasodilation. Okay, and it will increase the flow of blood, oxygenated blood, nutrient carrying blood to the lungs. So beta 2 very much rich in your lungs, okay, in your skeletal muscle. So suppose this is your skeletal muscle, and also so this is lungs, skeletal muscle. You can think about your liver, liver. So your lung function will increase. That will exchange more oxygen and carbon dioxide, and it will increase the oxygenated blood flow to the particular areas, skeletal muscle and the lungs, heart, and your liver, and also skeletal muscle, where energy will produce, and that will support you to do more exercise or more physical activity. And also liver, already I said, liver carry. So all those areas carry more beta 2 receptor. Okay, and beta 3 is basically present in your adipose tissue. Also present in different part of the body, also present in your urinary bladder. Okay, so it is basically present in your adipose tissue. So this is not basically connected with the cardiovascular system. Okay, so we can ignore that receptor. So actually, I tried to give you some basic. When you are in fight and flight mode, then how your body will help you to do more exercise. So your heart function will increase, your lung function will increase, your skeletal muscle function will increase, your liver function will increase, and that will be maintained by the adrenergic receptors, and basically the master molecule adrenaline noradrenaline. Okay, and other areas the blood flow will be restricted, and that same blood will be supplied to the particular organs by the support of beta 1 and beta 2. Okay, so this is the actual matter of adrenergic receptors. So now I will focus on beta blockers. So I will just omit it, the alpha part. Okay, and also I will omit the beta 3. But before beta 3, one drug actually won't work on this beta 3 agonist, that is mirabegron, and this is basically useful for your overactive urinary bladder. Okay, so this is not concerned about cardiovascular system, so I will just omit it. Now I will basically focus on the beta 1 and beta 2 receptor. Why I should block it for therapeutic purpose? Why I will focus on the beta blockers? Okay, so I just try to give you the basic, and now I will go for the details. When you are in normal state, you are in resting state, but your heart rate will increase, or heart rate is more than normal, you are suffering from hypertension, your blood pressure is more than normal, you have some cardiovascular problem. So what should you do? When you are in a flight fight mode, so of course the function of heart should be more than normal, already I said, but I am just taking rest, or I'm in just physically inactive mode, but I have some cardiovascular problem. That may be hypertension, or that may have your in your heart, that is angina pectoris. You can have a myocardial infarction, that is your heart attack, or even heart failure. Okay, hypertension, heart attack, heart failure, or even cardiac arrhythmia. So in that cardiovascular system, you should block the beta receptors, and that will be helpful for your cardiovascular pathology. Okay, cardiopathy. Okay, so now come to the point now. So when I should take beta blockers and why? That is our today's topic. So that is beta blockers. So already I said beta blockers. So now beta blockers. So that is the two types of beta receptor, beta 1 and beta 2. So if I go to the details about the beta blockers, then I must do or must mention the classification. So basically, it is classified as generation as well as selectivity. Okay, suppose one drug is only block beta 1 or beta 2. So you can say that is selective beta blocker. That can be selective for beta 2 or that can be selective for beta 1. Okay, but beta 2, normally when adrenaline noradrenaline bind with the beta 2 receptors, naturally it is doing vasodilation. So if you block it, then it will make contraction. So you should avoid it. And now, still now, no beta 2 specific blockers are available due to the logical reason, because it is responsible for vasodilation. So when your blood vessel is dilated, when your lung function, lung or bronchodilation, then your respiratory ventilation or respiratory function will be normal, your blood flow will be normal. When your blood flow to the blood vessel, the blood vessel is dilated. So that will be helpful. Some drugs have some problem. It can block the beta 1 as well as beta 2. So that is the inherent properties of that drug. So you may get some benefit, or of course you may get some side effect or adverse effect. Okay, so now which drug is responsible for blocking the beta 1? And already I said beta 1 is very much rich in your heart, also present in your kidney, that is your juxtaglomerular cell region, to facilitate to release the renin. Okay, so beta 1 very much rich in your heart. Okay, so you can say drug will bind or block only beta 1, that is called selective beta blocker. Selective beta blocker. Okay, and already I said the beta 1 is very much rich in your heart, so you can say cardioselective beta blocker. Cardio-selective beta blocker. Okay, although beta 1 is also present in your RASS system, that is renin, angiotensin, aldosterone system. But already I said in your juxtaglomerular region for renin release. Okay, so this is the selective beta 1, and you can say cardioselective. Why it is called generally cardioselective? Because beta 1 very much rich in your heart, so you can easily say cardioselective beta blocker. And which drugs or agents will block both beta 1 and beta 2? So you can say this is non-selective beta blocker. When it will block both, it will block the beta 1 only. Just I'll say beta 1, and in red color mark I will say it will just block. So this is the selective beta 1. And when it will block both beta 1 and beta 2, so you can it will block some agents, so you can say that is non-selective beta blocker. Okay, so I can give you some example in generally, then I will go for the generation for your better understanding. So I can give you one example, that is selective beta blocker like bisoprolol, you can say atenolol, you can say metoprolol. Okay, and non-selective beta blocker, you can say propranolol, you can say pindolol, you can say timolol. Okay, so these are the selective and non-selective beta blockers. Now I will go for selective and non-selective. Based on that and some other benefits, I will go for the generations. So according to the generations, beta blockers are basically, so according to the selectivity or specificity, it is two types: selective beta blocker, non-selective beta blocker. And selective beta blocker is usually called cardioselective beta blocker, and this is the non-selective beta blocker. Okay, so now I will go for the classification as per the generation. So according to the generation, beta blockers are basically three generations. Okay, first, so I will go for first generation. So first generation beta blockers is non-selective. So this is the non-selective. I will not use the red color. So non-selective. Why it is called non-selective? Because it will block beta 1 and beta 2 both. Okay, so this is the non-selective beta blocker. So already I explained, already I give example, but again for your better easy understanding, that is the example is basically propranolol, pindolol, timolol, you can say penbutalol, like that. So these are the non-selective beta blockers. That means it will block both beta 1 and beta 2. So why it is in the first generation? Because it has some problem. Why? Because it will block the beta 2, and beta 2 is basically in normal level, or you can say in emergency level, this is a vasodilator. So it will block the vasodilation, so it will make the opposite, and it will decrease your lung function by bronchoconstriction. It will decrease the blood flow to some areas like your skeletal muscle, like in your liver glucostatic mechanism pathway. So that will show the negative impact on your body. So it has some problem. So you can say non-selective. It has some limitation. Here you can add, that is, you should not use non-selective beta blocker for your asthma patients because it will cause further bronchoconstriction. So this is the limitation. To overcome this problem, you can go for the second generation. So this one is the second generation. That is selective. What type of selective? Already I said, you can say cardioselective. Why it is called cardioselective? And why it is called selective? Because it will block only beta 1. Okay, it will only block the beta 1. which is rich in your heart. Okay, so I can draw here your heart, and this is in your heart, and you can say this is on your lung. Okay, so example already I have given earlier, that is metoprolol, atenolol, bisoprolol. These are the selective beta blocker. So why it is in second generation? Because it will not block the beta 2, and it will not cause any bronchoconstriction. Actually, this is good for your respiratory problem. Now for your third generation. So this one is your third generation. Third generation has two types. One is third generation selective and third generation non-selective. Okay, so selective means, again I have to draw, that is your beta 1. So the question will come, why it is in third generation? So of course it should have some benefits. So you can write here, and others benefit. Okay, and here non-selective, that means already I said that would be beta 1 and beta 2. It will block the beta 1 and beta 2. So why it is third generation? So it has other benefits. Okay, what are the benefits? Other benefits? Before that, so I should give some example. That is selective, cardioselective, third generation beta blockers. That is your nebivolol. You can say betaxazole. Okay, these are the selective third generation beta blocker. So why the other benefit? Here, this one, the other benefit is it will increase the nitric oxide synthesis from release from your endothelium of your blood vessel. Okay, and that this nitric oxide is naturally more highly vasodilator. Okay, so when you will get beta, when you will block the beta 1, so it will decrease your heart rate, it will decrease the release of renin in your kidneys, and also it will just dilate the blood vessel. So you will get excess benefit. So that is the third generation. Okay, and this one, your betaxazole, that will block the beta 1, and also it has calcium channel block activity. Calcium channel blocking activity, and also it has antioxidant activity. Okay, so this is the extra benefit. So this, why, for this reason, this is in third generation. Okay, so now I will go for the non-selective. So non-selective means already beta 1, beta 2 will be blocked. So as it is in third generation, so of course it should have extra benefit. So what is the extra benefit? Extra example is your carvedilol. Okay, and this drug, the extra benefit is it will block also the alpha 1. And earlier I said this alpha 1 is vasoconstrictor. It is mostly present in the blood vessel in the region of your skin, your GI tract, your kidneys, like that, and that will restrict the blood flow in emergency situation. Okay, so if you block the one, so you will get the vasodilation activity. Okay, so it will block beta 1, also beta 2 as non-selective, and the extra benefit is it will also block the alpha 1, and also it has some another benefit, that is your sure that will block the alpha 1. Also benefit is antioxidant activity. Also it has anti-inflammatory activity. Okay, so for this reason it is in third generation. Okay, so now I will go back. Non-selective, that means it will block beta 1 and beta 2, so it has some problem if you will not use those drugs for your respiratory problem. Okay, so now you will get some extra benefit in your in your non-selective beta blockers. That means this drug is widely used for migraine pain because it can cross the blood-brain barrier, and it is widely used for your migraine pain. And this drug is not widely used. Pentobarbital is also not widely used, but this drug is used for your glaucoma. So this is for your migraine pain, and this is for your glaucoma, because it will just decrease the aqueous humor secretion from the your ciliary muscle. Okay, so this timolol is used for the glaucoma, and as propranolol go for the can cross the blood-brain barrier, so you can use for migraine, prophylactic use as a migraine. And this selective basically used for your hypertension, your cardiovascular problem like hypertension, and particularly for, I will say, this can also be used for migraine, but basically used for hypertension. This one is also mostly used for hypertension, and this one is used for hypertension. You can use for your heart failure, congestive heart failure. You can use for angina pain, angina pectoris. You can use for post myocardial infarction or long-term use. This is very important drug, and nowadays this drug is widely used for your cardiovascular problems, basically your cardiac problem. Also, you can use for arrhythmic problem. Okay, so why? Because it will block the beta 1 from in your heart, and it will decrease your inotrophic effect. That means your heart rate, force of contraction, then finally heart rate. Also, it will block the beta 1 in your kidneys, glomerular juxtaglomerular cell, that will decrease the renin release, and that renin release will not convert the angiotensinogen to angiotensin 1, and it will just inhibit the renin angiotensin pathway, and it will decrease the sodium water retention, and finally blood volume, and then finally blood pressure. Okay, so directly it will decrease the blood amount of blood, and also it will decrease the congestive heart venous return, and also directly it will decrease the heart rate. So it will decrease the demand of oxygen or nutrient in the heart. So if someone is suffering from coronary heart disease, so they can use beta 1 blocker, basically selective. Okay, so now the third generation selective. So as like the selective second generation, but it is extra benefit. So carvedilol is basically used for the hypertension. So a extra benefit. So the aged people, they have not managed by this single drug or other drug. So you can go for nebivolol, and also you can go for heart failure. Okay. So this one is hypertension. You can say heart failure. Okay. And this one is basically not used, although it has some extra benefit, but it is widely specific for beta 1 receptor in your ciliary muscle. Okay, so it is widely used for glaucoma. Okay, so this is the glaucoma specific drug, and this is also glaucoma specific drug. And last one is very important, that is carvedilol. Carvedilol is widely used, and if you just observe the myocardial infarction patient, that is heart attack patient, mild or post-operative, or you can say some other cardiac complications, heart failure. So each and every prescription nowadays the carvedilol is used. So carvedilol use getting increased day by day because it will block beta 1, beta 2 as well as alpha 1. Okay, so it will get extra benefit. It has also some antioxidant activity. So it will inhibit the oxidation. The aged people are free radical formations are increasing, so you will get benefit. Also, it has anti-inflammatory activity. The most of the cases, non-communicable disease basically initiated by inflammation, oxidation, inflammation. So it has another benefit. So multiple benefit. Although it has beta 2 antagonist, and carvedilol is used basically in low dose. It will block the beta 1 and 2 receptors, but you will get the extra benefit of alpha 1. And alpha 1 blocker you can consider as a vasodilator. So you will get the benefit from that. So this is all about the beta blockers. Okay. So now I will go for another thing, that is in your sympathetic mode, or you can say adrenergic pathway. Another thing is you must consider, that is ISA and MSA. What does it mean? ISA means is intrinsic sympathomimetic activity. And what does it mean? MSA? MSA means your membrane stabilizing activity. Why I will go there? Now I will just explain it, although it is not considered widely, but you should know about your better understanding of beta blockers as well as cardiovascular pharmacology, or you can say cardiovascular physiology. So now, what does it mean, MSA or ISA? ISA means the intrinsic sympathomimetic activity. So the intrinsic means your inner ability, and sympathomimetic means as like sympathetic activity. So sympathetic and mimic as like activity. That means some drugs will block the beta receptors. You can consider it a beta blocker, but it will block partially, and you will get in some extent you will get sympathetic activity also. That means it will partially block. So you can say partially agonist, or you can say partially antagonist, as it blocks the beta receptors. So you can say beta blockers, and you will get some intrinsic sympathomimetic activity also, as it is a partially beta blockers. Okay, so I can categorize here. That is the ISA, and that is the MSA. So I will give you some drug example. That is, you can say your penbutolol, you can say pindolol, you can say acebutolol. So these drugs has IS activity. That means it will block partially beta blockers, and you will get some extent sympathomimetic activity also. Okay. So what is the benefit? Benefit is that it will prevent some bradycardia, as it has some sympathomimetic activity, intrinsic activity. Okay. So you will get, to prevent bradycardia, unwanted bradycardia, you will get such type of drug for that. Okay. Also, someone is just doing exercise, and to do to get benefit as well as to prevent the bradycardia, though these drugs can be helpful for you. Okay. So this drug basically used for to prevent the bradycardia, and it will be helpful for your rigorous exercise. Okay. And now MSA. MSA activity means your membrane stabilizing activity. That means your membrane has some voltage gated sodium channel, and when sodium channel will open, it will cause depolarization, and it will get it will give the activation activity of the corresponding cell. That can be your cardiac muscle, that can be your neuron, or that can be your vasomotor center. Okay. So if you get some benefit, like it will block the voltage gated sodium channel. So that is the membrane stabilizing activity. Actually, this membrane stabilizing activity is not applicable for the beta blockers at the therapeutic dose. Basically, it is connected with the high dose of beta blockers. So usually, why we will take the high dose beta blockers? So in that case, MSA activity is you can ignore it, and it is not considered in the therapeutic dose. But some drugs had MSA activity, and you will get some benefit, like propranolol. Okay, and this propranolol, it is a very lipophilic drug, and it will cross the blood-brain barrier, and it has some MS activity at high dose, basically 40 milligram per kg, 40 milligram, or you can say 80 milligram. So you will get the MS activity, and that will be helpful for your migraine pain. Okay, you can connect the migraine pain. That is the propranolol. Also, metoprolol has some mild MS activity. Metoprolol. Also, carvedilol some activity. Carvedilol. Some betoxolol also. But mostly this MS activity is strong, and this MS activity is mild, but it is not considered at high dose. So you can ignore the MS activity, but for propranolol you can consider at high dose. Okay, so this is all about your beta blockers and IS activity and MS activity also. So this is all about the beta blockers. Okay, so now just try to connect overall beta blockers and your cardiovascular benefits. When someone is suffering from hypertension, that means the normal blood pressure, then high blood pressure for the conditional, and when it will persist or sustain, then you will be suffering from hypertension. So you must decrease your heart rate, or your blood vessels will be dilated to get the benefit, cardiovascular benefit. Also, you can block the beta 1 in your kidney, that is juxtaglomerular cell, and finally it will inhibit the release of renin, and finally renin angiotensin aldosterone pathway will be inhibited, and finally you will get the cardiovascular benefit. This is all about beta blockers. If you think this is a worthy video, you can watch, you can share. Thank you very much.